Let me just say that I'm really honored to be here today with you all. I had the pleasure of being there last year and meeting some special people, and hopefully it was a topic that was timely, somewhat informational for many of the members that were present. I'm giving this topic again. I'm doing this because Phyllis is a champion of Kinship Cares, as we all know, and she has such a patient advocate and such a passion for Kinship Cares and all the families. And it's hard to say no to anything to Phyllis. So I'm really excited to be here and provide this conversation. Angela or Phyllis, maybe you can fill me in. Are the majority of participants today Kinship Care members, administrators, families? If you can just give me an idea of who the audience is so I know the context. Phyllis, can you hear me? You may be on mute. Yeah, you're on mute.
Okay, so it's a combination of Kinship staff and Kinship caregivers.
Mm-hmm.
Okay.
Yep.
Very good. All right. So, thank you for letting me know that. This conversation on caregiver syndrome is somewhat timely because, as our population ages, many of us, including myself, are caring for individuals who probably cannot care for themselves. And it makes it very challenging to do this. But we take this responsibility for multiple reasons. In Kinship Cares, obviously, there's reasons, and all of us here probably have some sort of connection with either family members or maybe distant family members or relatives, maybe neighbors that we look after. And the unfortunate stress that is associated with that, the ability to provide this necessary care so that these individuals who we really care for are taken care of and that they have a fighting chance in life, of course. Many come from disenfranchised backgrounds, maybe a loss of an immediate family member, maybe a new condition that's really affecting their mental well-being, their emotional well-being, their physical well-being, or a combination of all. So again, I think this is a conversation that we will all probably have some sort of connection with, and hopefully you'll learn something. So we'll move on. Next slide, please. All right, so the objectives of this conversation today will be, again, to define what caregiver syndrome is. If you can go back one slide. Thank you. We want to also identify the most common symptoms of caregiver syndrome, provide some general statistics in the United States of how prevalent this is, caregiver syndrome impact on our own health, the medical provider's role, if you're a nurse, if you're a medical assistant, if you just, are in the healthcare profession, taking care of someone who needs, care, prevention of caregiver syndrome, treatment, and then, of course, timely resources that we should all have at our disposition to collaborate with and help us. So I always like to start things off with a case study. That's my physician mindset, to be able to give an idea of what type of patients, at least that I see in my my day. So this is a person by the name of JC, who's a true patient, who's a 72-year-old, now she's 73, with a history of moderate Alzheimer's dementia. This person was diagnosed 5 years ago with dementia. She's accompanied by her daughter, Isabel, who's her primary caregiver. JC has moved in with Isabel since the summer of 2018. She has increasingly been more confused over the past several months. She's probably not, at this point, not able to recognize immediate family members and tends to wander around the house more than before. JC has also become more combative and irritable and sometimes refuses to even eat her meals. After examining JC, Isabel becomes quite emotional and begins to cry. She states that she's overwhelmed, frankly, and exhausted with this constant medical appointments, anxiety of her mother not recognizing her anymore, and wandering around the house, especially at nighttime when she's asleep. This has caused Isabel to miss work frequently, more than she would like. When at work, she feels guilty that she's left her mother behind alone at the house and has difficulty focusing on her job duties. She works as an accountant for HR Block. Isabel also adds that she would like me to perform a physical on her because of Isabel's headaches and chest pains that she's experiencing as of late. She's convinced that she might have or soon develop a heart attack or stroke due to all the stress for caring for her mother. And I'm sure this probably sounds familiar to you or to someone that probably is taking care of someone in the house. Not necessarily an elderly patient, could be also a young person too. Next slide, please. So what is caregiver syndrome? It basically is what it says, right? It's a condition which causes the caregiver to experience anger, stress, fatigue, inability to focus due to caring for someone else. And again, these individuals are usually elderly individuals or younger individuals with chronic conditions, or maybe even the very young adolescents, children, toddlers who need attention. And it's a chronic condition that, if left unattended, could lead to anger, anxiety, and depression amongst these caregivers who are now responsible for that care of this loved one with either chronic illness, in the case of JC, dementia. The caregivers feel, again, exhausted for taking care of their loved ones with complicated medical conditions, and they neglect their own health, which may lead to illness or maybe even exacerbations of their own chronic conditions if left unmanaged. So if they have conditions like hypertension, they forget to take their blood pressure medicines. Because they forget to take their blood pressure medicines, they may develop a stroke or a pre-stroke and need to be taken care of for themselves. Overwhelmed, isolated, exhausted, anger, anxiety, guilt, depression, you choose the symptom. Usually a caregiver experiences these. Withdrawal from friends and family, loss of interest in activities previously that they enjoyed. They may feel irritable, hopeless, helpless, changes maybe in their appetite where they're not eating enough or maybe eating too much. They've lost weight, they've gained weight. Maybe they also may experiment with illegal substances such as drugs or maybe alcohol as a mechanism to cope for this stress. And as we all know, sometimes individuals use these substances just to try to relax them, and that can also cause other problems. Next slide, please. So the primary symptoms of caregiver syndrome, the most common ones, if you query or you ask individuals, would be anger, just angry and very upset all the time, anxious, feeling like things are really just going bad, and worried and constantly stressed. That can lead to depression. And depression is a diagnosis that, if left untreated, can lead to other complications, such as even increasing the rate of suicide. And if you, again, have depression associated with caregiver syndrome, and you have other coexisting conditions, diabetes, high blood pressure, COPD, it can make those conditions worse. Next slide. So let's look at some statistics in the United States, because it's important to understand the prevalence. What is this occurring just locally here in South Florida? Is it occurring, nationally? Yeah, it is. And as a matter of fact, according to the American Academy of Geriatric Psychiatrists, 1 in 4 American families will take care of someone over the age of 50 years of age. And I'm one of them. Actually, I have a mother that lives here at my house with my wife and I, and she's 83, and thank God she's doing well, but there are moments where she needs, a lot of attention and a lot of assistance, and which can stress me out. So I'm part of that caregiver syndrome as well at times. So, and I'm not afraid to tell you all, because it's important, because this can affect all of us. Silver tsunami. So I think you've heard the terminology tsunami. It's usually a large wave that can be quite destructive after an earthquake. We experience an earthquake. And silver is for silver gray hair. This terminology is used for the increasing amount of retired people that we're seeing in the United States. The population is aging. We're living longer lives because of technology, hopefully, good medical services, better access to care. As a matter of fact, each day in the United States, 10,000 people celebrate their 65th birthday. Let me repeat that statistic. Each day, 10,000 Americans celebrate their 65th birthday. In the 2000 US Census report, which we're having another census now for 2020, as we all know, 35 million Americans were over the age of 65. We suspect that by 2030, that number will be 71 million. So actually more than doubled in just a period of 30 years. That's pretty impressive. The amount of individuals suffering from caregiver syndrome, therefore, will only double as well, because again, who's going to take care of these individuals? It's going to be people like us. Next slide, please. So how does caregiver syndrome negatively affect our lives or our health? So according to a well-known professor of geriatric psychiatry at the University of Washington, Peter Vitaliano, he's published a lot of work on this. Chronic stress from taking care of a loved one can lead or worsen, again, hypertension, diabetes, or other conditions that are affected by the immune system. Stress can lead to increased hormones. We've heard probably these terms before: epinephrine, norepinephrine, cortisol. These are naturally occurring hormones that we produce every day, but we produce more of them when we're stressed. And when we're stressed and we produce these hormones, not only do they affect us by causing us to feel hot or clammy, sweat, give us headaches, but they can also raise our blood pressure. They can also raise our heart rate. They can also raise our sugar level if we're diabetic. They can also make it difficult to breathe. So these are the negative effects that stress have on the body from a scientific level. If anyone ever asks you, Mom, or Dad, are you stressed? Yeah, I'm stressed. Can't you see it? I'm sweating. I feel uncomfortable. I'm not hungry anymore. Yeah, because those hormones are impacting negatively all of our organs, not just our heart, our lungs, our brain, our kidneys. So we have to be very careful on how we manage the stress and try to do things to prevent caregiver syndrome, of course. Next slide, please. So the health impact, talking about this in more detail, caregivers can also take on many of the symptoms of the chronically ill member. So, for example, if caregivers caring for a member, let's say like myself, with dementia, will actually develop progressive memory loss themselves, resembling dementia. It's not necessarily dementia, but you got so much things going on, doctor's appointments and, worrying about your loved one, that you tend to start forgetting stuff. And I see that quite often in individuals who come to my practice who, are caregivers, similar to what you saw with Isabel in that case that I expressed, who start complaining of symptoms themselves, of whether it's forgetfulness or chest pains or shortness of breath, that may mimic or may look similar to the people they're taking care of. So elderly caregivers have a 63% higher risk for developing death, or what we call mortality, than those who are not caregivers. So that's even more impactful. Think about that statistics. We're not talking about half the population. We're talking 63, which is a lot more. That's statistically significant, as we like to say in the medical field, that if you are caring for someone with a chronically ill condition, guess what? You're going to probably, are more likely to have a negative impact that can actually lead to death, more so than someone who doesn't have that responsibility. So, for example, caregivers who get their mammography, women who should be getting their mammographies every year for breast cancer screening, they may get a diagnosis of breast cancer, something suspicious of breast cancer, but because they're so preoccupied taking care of their family members, they don't get the care that they need at that moment, because they're concerned of who's going to take care of Mom, who's going to take care of Dad, who's going to take care of my kinship, child that I'm taking care of now, that I'm responsible for. I don't have time to go to the doctor's appointment, and I know I have this mass on my breast, but it's just going to have to wait because it just has to. Caregivers with congestive heart failure, which is basically an inability for the heart to contract normally, end up, not taking their medications, which leads to fluid to build up in their lungs and causes more shortness of breath. And then you're admitted to the hospital for at least 3 days, and to try to manage that and get all that fluid off your lungs. And that increases your risk for having a heart attack. And a heart attack basically is permanently damaging your heart. So it's not going to be the way it was before, and you're going to be more short of breath with this even simple walking to the refrigerator or the door. Next slide, please. So other things that impact our health is time off of work. Like as I discussed with you, Isabel, in the case that I have, she was taking time off from work because she needs to be with her mom to take her to the numerous doctor's appointments. It's not with me, it's the neurologist because she's got this dementia. It's her cardiologist because of her blood pressure. It's the nephrologist because of her kidney problems. It also affects our sleep cycle interruption because we're constantly worried about our loved ones and their well-being, and it's hard to go to sleep. And I'm sure all of us here on this call have been, have those sleepless nights, right? When we're worried about something, and especially if it's a loved one. Transportation issues, again, our loved ones, I use JC, who has dementia in this case, because we're not going to allow JC to drive to herself to any doctor's appointments, or to Publix to Winn-Dixie to buy food, or to Walgreens or CVS for their medications. We're going to do it, and that's takes a toll on us, because we're going to find that, in addition to taking care for our children and other things that we have to do. Hopefully you have a spouse who can help with those chores at work, cooking, cleaning, doing laundry. But if you don't, then that's all on your shoulders. The financial burden, because now that person is living with you, or maybe they're not living with you, but you are now financially responsible for paying their medications. Maybe, since they can't work anymore, paying for other things that normally you wouldn't pay for. And then, of course, the prioritization of the family life. Before it was, if it was me, it was prioritizing my wife, who I love very much, but maybe at that time I have to put that aside because my mother needs my attention, or our child, special needs attention. So you have to really prioritize. So again, increasing this burden. Your hobbies and activities, the exercise that people like me always recommend my patients to do, well, you have no time anymore, because you're compelled to be with that person who needs you. And then, of course, you're neglecting your health matters. Like, as I discussed before, you stop going to see your physician or your nurse practitioner for care. Next slide, please. So why do caregivers feel stressed? Well, it's one thing is role confusion, right? It's difficult to separate your caregiver role from that of being a parent, spouse, sibling, or friend. So let me explain that. This is your mother, this is your father that you're caring for. You're supposed to be the child, right? They're supposed to be taking care of you, but now the roles have reversed. And that's very stressful to see the deterioration, and the stress that's associated with that. Number two, unrealistic expectations. These conditions are usually progress in these elderly individuals. It doesn't get better. It typically gets worse over a period of time. And so you always try to set goals. This is what we need to do to get better. But unfortunately, these are attainable goals when you're dealing with medically ill loved ones. Because typically, depending on the case, if it's cancer, if it's Alzheimer's, you don't really have good treatments or cures. It's a progressive disease. So you got that, also, that you really don't have a solution other than just to be there to help and help mitigate any emergencies, urgent things. Lack of control. Again, you're frustrated because you don't control the situation. The situation controls you, right? There's no way, again, to offer a treatment for this. It just doesn't happen. And then other factors like lack of self-awareness of caregiver to reach out for help. Typically, what we see in caregivers is that they keep things to themselves. For some reason, they don't discuss these feelings and frustrations that they may have and the anger issues, because they don't want to feel like anything weak, especially men. Want to keep it to themselves. Certain genders feel like they have to be in control all the time. It's not, good to express your feelings. It could be also related to certain groups of people, ethnic groups as well. So that also, a lack of ability of just telling people how you feel just increases the frustration even more. Next slide. So again, as I said to you before, this syndrome is progressive. This anger, anxiety, depression can lead to exhaustion over a period of time, despite even the best of resources to help reduce or mitigate the decline of function and health. This decline will ultimately negatively impact the member's health, lost appointments, poor attention to medical needs of member, discourse with other family members. I see arguments all the time with siblings taking care of loved ones, whether, if it's a parent, for example, is this the right thing? Should we put the parent in a skilled nursing facility? Who takes care of that? It needs to be, one of us needs to take care of it. Well, okay, I'll take care of it, but I need financial resources from you, my siblings, to help me endeavor that. And I need a break too. So you're going to need to take care of mom or dad Thursdays and Fridays. Who can help mom and dad on the weekends? And that's difficult to manage as well. Leads also to poor outcomes and the ability to provide quality care to the members. So of course, all this just collides and and then you're not really providing, as I am as a provider, a good quality care for my patients. Next slide, please. So double duty caregivers, and this refers to health professionals. And I know many of you may be health professionals here, and like myself, and we take care of elderly people. It's double duty because, you know, someone like myself and maybe like you are taking care of individuals in the daytime because it's part of your job, your profession. You have to have empathy, you have to have sympathy, you have to listen, you know, more than talking to be effective as a clinical person. But then you sort of go home and you're doing the same thing. And that's very exhausting because you never really separate your role as a professional. You're always working, caring for people. You can't separate or bifurcate that. And that's exhausting because that's a 24-hour job. And number two, work taking, you know, care of clinically ill and then comes home again for this chronically ill member, as I discussed. You feel guilt also, feeling vulnerable to anxiety, anger, depression. People who are healthcare professionals, you know, we're supposed to be in control. People come to us for solutions, right? We have to be the ones to offer that plan of care. And now we're sort of don't know what the plan of care is because it's affecting us in our personal life. Who do we go to for answers? Is it us? Should we even do that? I mean, I never like to be a doctor to anyone in my family, despite the fact that I get called all the time. And then a high rate of alcoholism and substance abuse, unfortunately, amongst healthcare providers. This is very well known that healthcare providers typically have substance abuse issues because of all the stress that is very difficult to manage, or lack of awareness of how to manage stress. And thirdly, lack of insight to reach help, because no one who's, you know, delivering healthcare services wants to be known as weak, or, you know, or that they suffer the same things that their patients do, of course. Next slide, please. So again, just on medical providers, you know, as a physician, sometimes it's difficult to even make a diagnosis of caregiver syndrome for my patients because I'm there, you know, generally seeing a patient for 15 to 30 minutes. And these patients, particularly the seniors or the very young who are chronically ill, have multiple problems going on. And it's challenging to manage everything, refill medications, start new medications, listen to their other problems that they may have, discuss referrals to specialists, interpret labs or any maybe imaging tests that I referred to the patient to get prior to that appointment. X-rays, mammographies, colonoscopies. I got to do all that in 15 to 30 minutes and go on to the next patient. So it's difficult to monitor and manage these chronic care conditions and see new conditions in my visits. So the patients may be reluctant also, because they see me hurrying up, to talk to me about their caregiver syndrome, right? To say, hey, doc, I'm stressed because I'm taking care of mom or dad or my child who's ill, or I'm a kinship family member and I'm taking care of my non-biological, you know, a grandchild or some child and who's not my biological child or my daughter's or son's child. And that's stressful too, because I'm the only resource here doing that. So the providers may not always have that focus or understand the symptoms to suggest this diagnosis of caregiver syndrome because we're doing other things. As a matter of fact, the American Academy of Family Physicians, someone that I look to as my organization for guidance on how to treat patients, they say that less than 50% of caregivers are asked by their doctors whether or not they are experiencing caregiver stress syndromes. So let's say I'm going to pick on you, Phyllis, because I know you so well. If you were my patient, and Phyllis is not, just want to clarify that, but if she was, and she's telling me about, let's just say her dad, who she's living with now and having problems, she may not feel compelled to tell me about that stress that it's causing taking care of her elderly parent if she sees me, you know, worried and talking about multiple things at one time, you know, and so she may be reluctant, and then I'll never be able to help her. And that happens a lot. So you need to really make sure that when you have this communication with the healthcare provider and you're seeking help, and that's the way you're getting help, that this is articulated, that there is a side to discuss this, because it is important, because it can be very destructive if you don't talk about it, and this continues to ensue and can really lead to negative consequences, not only for you, but also for the person you're taking care of. Next slide. So finally, caregiver syndrome is not really currently recognized as a disease, but there's a mental disorder, rather. There's something called Diagnostic and Statistical Manual of Mental Disorders, which is a guidance on how to diagnose conditions that is from the American Psychiatric Association. There's these references or guidance allows us to use this to diagnose depression, anxiety, bipolar, schizophrenia, post-traumatic stress disorder, amongst other things. And there isn't one for caregiver syndrome as of yet. Just blows my mind because this is increasing in prevalence, of course. Hopefully there will be soon. That will probably help because once there's a condition called caregiver syndrome, then I think most people will develop treatment plans for this condition. Right now, it's just haphazard and we're making it up as we go along. Again, this may contribute to lack of understanding by some people like me about what this is. I may not ask you, or your provider may not ask you about caregiver syndrome, may not even know what it is. So they're not really skilled to diagnose or treat this condition. But we know, like anything, right, any medical condition, early detection, prevention, and treatment strategies are quite important. Next slide, please. So if we were able to provide caregiver syndrome as recognized, then as it recognized as a diagnosis, such as other conditions like depression, anxiety, diabetes, high blood pressure, then we would probably do a better job in treating this. Because again, we would have a treatment plan. For diabetes, we treat with medications and diet and exercise and weight reduction. For high blood pressure, same thing in addition to medications when appropriate. For depression, same thing with medication and behavioral therapy, right? But for caregiver syndrome, we don't have that at this particular time. There isn't a protocol, an algorithm. So that's why it would be important to get this as an official diagnosis. So medical providers and insurance companies also would be more inclined to assist caregivers by offering dedicated programs to help treat their condition. But such as we have for people who smoke, we have smoking cessation programs by the American Lung Association. We would also have a program for caregiver syndromes. And that would be tested, tried, proven, and would be helpful for many people. So I think that's important to get. The American Academy of Family Physicians and the National Center for Caregiving recommend that all caregivers be screened for depression and stress. And we currently do that. If you come to a Broward Health facility, we screen everyone who walks the door, whatever your complaint is, if it's a wellness exam or coming for physical, you're coming for a condition to manage your blood pressure, we screen everyone for depression, and which includes questions of, how do you feel about yourself? Are you sleeping? Are you not? Do you cry a lot? Do you enjoy, pleasure in life? Have you considered committing suicide? All these questions are important. We do that every visit. And I think that's important because depression can occur at any particular time, right? Right now, we could be fine in this conversation, and then tomorrow we can enter a crisis. Next slide. So Kinship Cares, you guys do such a great job. I mean, for caring for toddlers, children, adolescents, of course, unexpectedly, right, due to circumstances when biological parents cannot do so. Big shout out, big hug for you. I personally admire the work that you do. You guys obviously are special. You volunteered to do this. It wasn't, you had a calling and to sponsor these special little young ones. And I applaud you for that. This exceptional care can and most often will cause some burden again on your mental and physical, as I discussed with the elderly people. So you are probably have experienced sometimes caregiver syndrome or are at risk for this. I think it's something, again, that we all need to do a self-check of ourselves and seek help if we are having these types of symptoms of anger, as I said before, stress, emotional things, and lack of interest in our own healthcare when we do provide assistance to others. Next slide, please. So same principles again of caregivers will apply to you. Time off, you have to take time off to help your toddlers, your young ones, your adolescents. Financial burdens, there is some financial assistance. It is minuscule. It's not much. I know that. I've had these conversations with Finos, but it is something, and we appreciate that, of course. But there are other financial burdens aside from just caring for their food and clothing, right? There may be other things, medical, other things that the children and adolescents and toddlers and young adults need. And then, of course, personal health. They need to go see their pediatricians or their doctors. You need to do that as well. So it's the same principles as what I was discussing. And who will support you, right? When you selflessly supporting your little ones, you need to have that support because you have a lot on your shoulders. And as I said to you before, if you don't have caregiver syndrome because you have great coping mechanisms, kudos, great, but you still are going to be at high risk for for caregiver syndrome symptoms, as I discussed throughout this conversation, that anxiety, that depression, that anger, that forgetfulness, the exacerbations of your own medical care, problems with siblings in your own family, those all apply to you. And you will be at risk because, again, being a kinship care member and family supporter is tough work. So in order to be truly successful at being a caregiver, you need to first take care of yourself, right? Your mind, your body, and your soul. If you can't take care of yourself, how are you going to take care of someone you love? It's just not going to happen. You can't be broken to take care of someone who is broken or is potentially broken or needs help. So it's a disaster. So prevention of caregiver syndrome, my recommendations, and I think most healthcare providers would say the same thing, go see your provider, whether it's someone, a nurse practitioner, a physician, go see your regular source of care to get a physical, just to check yourself out, right? And that should be done on a regular basis, no matter what, whether you are at risk for caregiver syndrome or not. Discuss your symptoms. Make sure that when you go prepared. Bring a list, as I always tell my patients, your top 3 concerns, and put, this information about caregiver syndrome right up there, because if you don't have care or treatment for this, everything else is going to get worse. Be open to help. Be receptive if they want to, if your provider wants to refer you to see a counselor or other resources, because we want to help. You have to recognize that we all need help at times in our lives, especially if we're caring for others. Be realistic about your loved one's condition. As I said to you before, if you're caring for an elderly person, most of these conditions are progressive without a true definitive treatment. So we have to be realistic. Everyone wants to take on, this idea that this is going to be cured. Educate yourself, read, speak with your neighbors, your friends, those here in kinship cares, to try to orient yourself as to, what are things that you can do and other resources to help you. Know your limits too. When to reach out for help, because if you don't, it's going to be catastrophic. It really will be. It'll start affecting your own care, your own health. Manage your stress. Something that's tried, tested, and proven and cheap is meditation. And I think that's something that's important. If you have a phone that's a smartphone, you can download some applications or something called Calm, an app. It's free. And, people that I admire in my life, like LeBron James, uses it. And, you can put it on and it can give you exercises to try to put you in your Zen calm mode on a daily basis. And I think that's important because we need to have that special time for ourselves, especially if we're caring for others. Sleep and nutrition, make sure that you find adequate, time to sleep. For example, you need a little minimum of 7 hours. I think a lot of us don't get that. I think probably the norm is 6 or less, but you really need 7 hours of sleep. And learn about sleep etiquette, that you should use your bed only to sleep. You shouldn't be using your bed to, use a computer or watch TV or have conversations, because then you're going to lose focus of what the bedroom is for, and it's to sleep, right? Do that outside of the bedroom if you can, and then go turn off the lights and go right to sleep. That helps be more successful. Nutrition, very important to eat at a minimum 3 meals a day. You've heard that breakfast is the most important meal. Well, they're all important, but don't skip meals, because we need nutrition in order to think well, in order to process, to have energy, to care for others. So make sure you are eating healthy foods, mixtures of vegetables and fruits, protein like chicken breast, fish, lean meats, nothing too fattening, nothing too sugary, because that's just going to make us feel tired. Lots of water too, lots of water. Maintain some exercise, and walking is exercise. So walk with your little ones, walk with, if you can, with your loved ones, even if they do have dementia. It helps everyone, I think, especially, early in the morning or later in the evening when the weather's a little bit better. And thank God we're entering now the fall. September, I think 22nd is the last day of summer. Hobbies, make sure you if you have hobbies, do them, whether they are, some of us may have hobbies that include reading, others may do hobbies of sewing or exercise or taking some vacations or whatever it may be. Do it. Make sure you carve out some time to do that, because you need time for yourself, and anything that will relax you is good for your mind, body, and soul. Socialize. Make sure you have a network of friends, family members that you can talk to, because as I said to you before, if you can't talk to someone about how you feel and all the good things that are happening in your life or negative things, then how are you going to reach out for help? You're never going to reach out for help. And again, it's going to be catastrophic for you. This stress will be untenable and unmanageable. And then you're going to start, having problems. And again, how can you take care of someone if you are having medical issues or emotional issues? And then reassess yourself. Take time outs and check yourself ever so often to see if you're doing all the things I just discussed. Getting regular care, sleeping well, good nutrition, water, exercising, socializing. Check yourself. And we need to do that at times. It could be daily, it could be weekly, but don't take more than weekly, because I think the stress can take control of us. So check yourself and pivot and try to accomplish all these tasks that I've discussed here with you. Next slide, please. So the treatment, again, of caregiver syndrome is discuss this with your provider. Make sure that your provider understands what you're feeling, explores, issues of how to take better care of yourself. Behavioral health. Listen, we all need to speak with someone at some point of our lives to get a better assessment of how we're doing emotionally, psychologically. Life's tough, and it's tougher when you're taking care of someone who needs you, whether it's a little infant, a toddler, an adolescent, an elderly person. It's tough business. And we need that. So don't feel weak to reach out to a provider. All of us do it. So you should be able to do it as well. It's okay. It's okay. Respite care. Respite care, as many of you know, is an institution that can take care of your loved one, while you can work, allows you to work, do your hobbies, see your doctors for your appointments. We need that respite care. Try to, get help for respite care. There are lots of organizations that can assist with that for your loved ones while you are taking care of yourself. And then support groups. There are plenty of these that are cheap. They're free. You can get them online. You can probably within your local community. This platform, what we're doing today in the next several days for Kinship Care, Zoom, Café meetings, I think is also a good support, group. We're all here together to learn a little bit, to share stories. And hopefully to educate those who couldn't be here today. Next slide. Now, next slide is really some resource list of organizations that can help. And you probably know a lot of them. And Phyllis was nice enough to help me compile this list last year. I'm pretty sure the numbers and the emails are still the same. National Alliance of Mental Illness of Broward County, Chrysalis Health, Catholic Charities of Archdiocese of Miami, Juvenile Fire Setter 211, we know that very well, helping abused, neglected, dependent youth are handy, and Mental Health America of Southeast Florida. I've included some numbers here, some websites and connections for you to look at, to browse, that can be helpful for you or someone you know with caregiver syndrome, people who are skilled at this, and these are free resources. So I encourage you to look at them or share them with someone who you think may need it.